I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
So if we place the center rotation in this position,
run. It's working well? Excellent. So I can shut it down now? Good. Good morning. It's my pleasure to welcome you to, it's my pleasure to welcome you to UMKC Faculty of Dentistry, Department of Orthodontics. My name is Dr. Jean-Marc Retrouvet. I'm the chair of this department. I've been here for a year. Very happy to be here. And on the slide, you can see our great residents, the 9 residents you met yesterday. Dr. Walker and Dr. Jim Osborne, who was the retiring director, and you'll meet Dr. Conley pretty soon. So the vision of the Department of Orthodontics at UMKC is basically to do innovation, but it's built on tradition. We are very proud of our heritage as a great orthodontic school, and I will present the part of innovation. Dr. Conley will present more the clinical aspect. So what we do nowadays, we do a lot of 3D work, and we tend to emphasize, especially in my part of what I do, the 3D aspect of orthodontics, which I feel is the future.
So if we place the center rotation in this position,
So this one is
and we
showing
start
a,
rotating the tooth.
wait a second, we just have a tiny glitch. Thank you. So what I'm showing here is a way to teach now that we use simulations, 3D models. We just import all the models into a special program that allows us to teach orthodontics and biomechanics into a different perspective. This is what you will feel like when you show up first day in school. We have all these words. It's a new language. Orthodontic language is different from dental language. And slowly but surely, at the beginning you'll be a little bit lost, and surely but surely, we will be organizing your thoughts, so at the end of your residency, you'll be able to have great outcomes and become great orthodontists. We use 3D imagery. The one on the left is a cone beam, as you know. I use also some other programs, which is delivered by the green image. And then we can go all the way to STL files that allows us to isolate the teeth and be able to plan some very interesting 3D printing. You see Dr. Osborne right here printing a craniofacial patient that we are working on slowly and hopefully get a great outcome. But these are the new technologies. This is a bit complicated, but if you look at the more day-to-day applications of orthodontics in the 3D world, well, this is what's going to happen pretty soon in our field. You can now see that you can move the teeth. Don't look so much at the bone because it's not perfect. But what happens is it will allow us to move teeth right on the cone beam with the roots, the crowns, and you'll be able to be much more proactive in your treatments. That's done by a friend of mine, Dr. Svess from Paris, France. He's a very astute 3D orthodontist, and he does a great job. This is my work. So let's say you're missing a lateral incisor, and you want to replace it, putting a canine into this place, and you want to know how much you have to reduce. Well, you can simulate the amount of reduction, the red being the most reduction. You can see on the left side that even if you reduce, the roots still stay fairly wide. So these allow us to kind of be, again, do some simulation, being proactive in what we do. And it helps, I would argue, the treatment and the outcome of treatment. And this one is an open source software. Basically, it's free. We use it at UMKC almost on a daily basis. So what do we do with this? Well, we also have introduced this year the in-house department where we are going to be printing all sorts of materials. You can see one is obviously an aligner. This one happens to be an Invisalign, but we can print anything else. The lower right is a 3D indirect bracketing system that we are working on with a company, and the one on the upper right is a third molar, which has been extracted from a cone beam virtually and printed in 3D to do some transpositions. The left side also is how you manipulate the dentition using the software. And in the middle, this is one of our 3 cases done by one of our residents, where we just print a series of models and we basically fabricate the trays on site. and that's me working the case when I used to have not a beard. We're also we're lucky to work with many hospitals in the area, and we just want to collaborate with the medical field. Orthodontics is very much involved in sleep apnea. We can do cone beams, we can do reconstructions of pharynx, we can see where is the obstruction and what happens if orthodontics can help or not during these cases. So that's also what we do, and this is done by Anatomage. It's a specific software that does wonderful imagery and help us to really get a better, I would say, appreciation of the anatomical variations of our patients. We also do research projects. Well, at the moment, with Dr. Walker, we have also a project with the NIH where we actually, if you look on the left-hand side of the screen, you will see that we have basically taken a cone beam, reconstructed it. We have cut the maxilla, which is the yellow. We have inserted the intraoral scan in the setup, and now we can move the teeth with the roots, as I showed you before. And that allows us, especially in very complicated malocclusion like this one, to really see the limit of what we can do. On the right-hand side, it's a paper we published in the Journal of Bone Mineral Research about variability in cone beams in osteogenesis imperfecta patients. And we're also pretty proud that we made the cover page of the JADA in July 2020 with one of my students on, again, osteogenesis imperfecta, and that's really a good thing for us at UMKC. What we do also, and this one is a brand new project, it's a bit of a simpler project where we look at artificial intelligence supported cephalometrics. This is a case that has been traced with a conventional digital X-ray system, which is called the Dolphin imaging system. And this one is actually traced by, not traced, but the points have been recognized by new software from WebCFX from Korea, where they recognize these points without you tracing anything. They trace the outline of the facial profile and the bones all in less than 1 second, which is pretty impressive. So we're working on this at the moment to see what we can do with this software, if it's accurate or not. And we also do some research. I'm just starting this research on final tenement analysis, which you can see on the right-hand side, which is a reconstruction of the bracket and a tooth. And on the left side, what we have is the rendering of it with the brackets and the teeth. We can move now the teeth into their normal position on the computer and reverse engineer the placement of brackets. It's still not perfect. It's AI-driven, which means artificial intelligence-driven, so it takes a little while. But I would argue that by the time you graduate, this would become a lot more common because the materials are getting better, everything is getting better, and within 2 or 3 years, which the pace of progress in the AI world, we should be ready to deliver very, very precise bracket placement. Obviously, we can work this also with Invisalign and all the aligner technologies. We should not forget the clinical excellence also with conventional brackets. Many people think, oh, AI is coming and brackets are coming, but you know, brackets are falling off because it's not à la mode anymore. But I would argue that you can still turn very, very great products and very good cases using conventional brackets as seen on the left-hand side, which is a rendering again of using, this one we used Geomagic, I think, or Studio Max, sorry. So this is what we do. We also do conventional orthodontics, and we're proud of delivering great result at UMKC. And I want to the warmest welcome to a great addition and professor, Dr. Conley. He was usually from Vanderbilt, stayed in Michigan, and now is with us at, he was at Buffalo too, sorry, and now he's with us for the past 3 or 4 months as a program director, sorry, at UMKC. Thank you for your attention, and have a great day. Come in, Dr. Conley, I guess. You want to wipe this up? Do the wiping thing.
Good morning, everybody. As Dr. Retrouve mentioned, I am Dr. Scott Conley, and my role of this presentation, is to go ahead and introduce you to the clinic, to the people that you'll interact with here in the Department of Orthodontics. So first and foremost, you see before you a picture of all of the full full-time faculty. You see Dr. Retrouve, you've already met virtually last night in the social, as well as at the beginning of this presentation. Myself in the middle, and one of our other faculty, Dr. Amin Nishaburi, whose primary roles are with the predoctoral or the dental students and helping guide them and their understanding of orthodontics. But as you now see in front of you, we have a large number and a very diverse group of experiences, practices, various different regions around the Kansas City metro area that help us out in the clinic. And these faculty are very dedicated, and especially right now during COVID pandemic, they still come out of their private practice offices to spend a time with us, whether it's anywhere from a day and a half a week to a half a day every other week. So they are a tremendous asset and a resource for our department. I look forward to introducing you to them. You'll meet some of them this morning as part of your interview process. You've already met and spent a great deal of time with our residents last night as part of the social. I'm sure they gave you some background information as part of the social. Did some ice-breaking procedures, if you will, in order to introduce you, start to get a feel for one another, and to help understand and decide as best as you can in this virtual environment that we find ourselves in these days. You know, is the University of Missouri Kansas City family, and we are that, a family that works together, we play together, and we have fun together as we learn orthodontics. Is this the right family match for you? And you see the first years on the top left, our third years on the top right, and for no reason other than fitting them on the slide, our second years in the bottom middle. We also have a wonderful team in place to help us. The front desk staff folks, Aaron David, as well as Kia Reese on the top level there, as well as dedicated dental assistants, orthodontic assistants, to help us with the individual day-to-day procedures, helping us with chair turnover, as well as the large procedures, banding, bondings, appliance deliveries, and so forth, helping you chairside to simulate as closely as possible. We won't ever perfectly be there because we don't have a one-for-one assistant ratio, but to help you get as close as possible to the private practice four-handed environment. Now, to give you a brief snapshot of our clinic, our class, and our research operations, you'll see some pictures begin to populate this screen. Right here we see Dr. Kendall Tada, working with one of our part-time faculty, I believe it's Dr. Klein, the back of his head. And you see Dr. Colin Schlosser working with one of his patients right there in the clinic. And this is the nuts and bolts, the routine aspect that you will be participating in many days of your experiences here at University of Missouri, Kansas City. We also recently, on that top left panel, we have access to the Innovations Clinic. We have some of our own extraoral suction devices, but the Innovation Clinic is where we first started. Right after the pandemic, we got the clearance to reopen the building. We moved into that area so that we could safely continue to treat our patients and give them the high quality care that they deserve, as well as the safety for our faculty, staff, and residents. Lower left, a shot of our clinic. You see Cindy there with the instrument cart. Dr. Osborne is the gentleman standing, as well as two of our residents working in the background. As Dr. Retrouve mentioned, we do have and we do feel that technology is important for your clinical and your didactic education. And what you see in the bottom right panel is Cindy, and she is manipulating one of the iTero scans on one of our iTero scanners. We anticipate having a second one coming shortly, as well as highly likely a 3-shape scanner as well. And then, of course, in this environment that we find ourselves in right now, in the sort of the second from the right there, you see a snapshot of the extraoral suction device to help us during the aerosol generating procedures, as well as one of our staff doing what she always did, which was bringing back the clean instruments. But it's very important, especially right now, for patients and parents to be able to see the instruments coming back clean on the cart, bagged, and so forth. And of course, we're very much up to the standard of care and far beyond. Now, certainly, it is the people, that, as I've mentioned, and these are what we all look like in our natural habitat, if you will. We're outside in the clinic when we can be, outside in the community when we can be. You see Colin, who just completed his thesis, genetic-based thesis there in the top panel, as well as Dr. Retrouve and his scrubs getting ready to see a patient chairside, as well as our front desk, our other residents in the bottom panel, and some of our assistants there in the bottom panel. We do have, and many schools don't, so I want to highlight some of the things that University of Missouri Kansas City has that maybe some other programs may not. We do have some dedicated educational space, classroom space. We happen to be standing in that right now. Unfortunately, we're unable to turn the camera around so you can see the room itself. This happens to be one of the shared classrooms that we use on the left-hand side of the screen there, as well as each resident has his or her clinic workstation right in the clinic. We build them into pods. We have a first, second, and third year in each of those pods. They all have computers. You see Grant working on OrthoCAD, doing some study model analysis, and then on the right-hand computer screen, he's looking at a cone beam CT with some bilateral impacted canines there, doing his diagnosis, his treatment planning, his mechanical setup, and so forth. You too will have your own private operatory, and I believe these even lock if you need to keep some private items in there. Now, as I mentioned, we work hard, but we do need to take a break every now and then to celebrate, to have some fun. The lower left there is, I believe, Cindy during her birthday or Dental Assistance Day, Kia during her birthday, and then on the bottom right we have all of our staff, Kia, Cindy, Aaron, and Shamil celebrating Dental Assistance and Appreciation Day. And we do hope that the workday is full of work, yes, but also some fun. And you see Aaron on his way home. He takes this, I guess, automated hovercraft to his car where he parks. Now, I do look forward to spending some time with each of you. We will have break into a series of private interviews with each of you. It'll be one of you as a candidate or an applicant, if you will, spending time with two formal interview teams. Dr. Retrouve and Dr. Osborne will comprise one interview team. I will comprise another interview team along with Dr. Klein. And then we will have a slightly less formal interview team composed of the third-year residents. And then in and out throughout the day, you'll be able to go back and forth to what we've called the cafe. We're trying to simulate this as best we can to being on site. So that's an excellent area to ask any questions that you may have of the orthodontic residents. If you have a specific question and you want to speak with a specific resident, using the chat feature, you can go ahead and mention that or invite one of those residents into a breakout room, and we can create a breakout room for you to hopefully answer that question. I will turn it over in just a moment to Dr. Mary Walker. As I do so, please remember, keep your computer hardwired into the internet. Once you're logged into the morning or the afternoon cafe, it's very important to stay into that. If you need to take a break for a moment, please go ahead and mute your microphone as well as block your camera, and then take care of whatever you may need to take care of, and then come right back in. But do maintain an open connection to that cafe so that we minimize the risk of any connection issues. I look forward to spending some time with you, and I will now turn it over to Dr. Mary Walker, who will provide a video with pictures of the Kansas City metro area and of all of the residencies to give you a bit of a feel for the area.
Well, good morning, everyone. Glad to have you here. I know you joined us last night. Hopefully that was a great experience for you. As I told you last night, I'm Mary Walker. I'm here in my role as the Associate Dean over our Advanced Ed programs, our residencies, and our graduate programs. You saw the video showing you what do we have in terms of residencies, and there you can see the list. And besides residencies, we also have a couple of actual graduate degree programs, oral and craniofacial sciences, where you can get a master's and a PhD, and the dental hygiene education program, where they have a master's. And as you can see there on the lower part of the slide, my role is the Associate Dean, and then I wear another hat as the Director of the OCS program itself, the graduate program. So, I want to tell you a little bit about how we can support our residents, what the School of Dentistry will do. And one very important one is the stipend, a $20,000 annual stipend, which is basically you receiving a salary. As a resident, you are an employee, and so that's paid monthly, end of every month. We also have tuition waivers. We'll talk more about that, but you can see that's at $10,000 annual benefit, and you can see how it's distributed across each semester. Then the important part is the tuition itself. One very nice benefit, no matter where you come from, you will be eligible to receive Missouri in-state resident tuition rate. That's a plus because if it wasn't, it'd be double what you see there. You can see that annually it's about $23,000. But that's before the tuition waivers applied. So in terms of your responsibility, it's about $13,000 after the waiver. And of course, these are estimated numbers based on current tuition rates, but it gives you a pretty good idea of what you would be dealing with. I guess the point is, I think we're a very affordable residency. Besides being, getting a salary and besides the tuition waiver, and besides being affordable, it's a very high quality residency. And I think another benefit is that there are 3 residents per class. I think that means you get the kind of attention you need individually. That can be a real plus too. Other support is registration assistance every semester. Now you may think, well, that doesn't seem like a big deal. Well, I went through this program. I went through the prosthodontic residency program here at UMKC, and every semester, because it's very complicated, it was so challenging to get registered, and pretty much every semester there were errors. And at the time I thought, if I ever am in any kind of position, I would make sure that somebody else took care of this. And so that's what our office does. It's a benefit you may not be able to appreciate because you haven't actually lived the other side of it. The other piece is having the Advanced Ed office and an associate dean overseeing the programs. We can look across programs and do, planning for interdisciplinary activities. Having been a general dentist and as a prosthodontist, I'm very aware nobody practices in isolation. You need to be able to work together, and so we start that process while you're in the residency, interacting at many, many levels. Of course, UMKC is part of the match, and so in terms of if you would match with us, what would happen next is you'd receive an acceptance email, and we ask you within 48 hours to reply, basically accept. And then part of that is asking you to pay a $1,000 seat deposit, but that would go to your next summer, the first summer's tuition. And then because, as I said, this is an employed position, you would complete an employment application and do a background check. One other important item on there is maintaining a 3.0 GPA. And I know you've all done well, and that isn't something you've had to worry about, or you've worked hard to make sure you have a high GPA. But between now and joining us, you still have to keep that. Only once have I seen an applicant, somebody who was accepted, decide to go on vacation, didn't keep a 3, and then couldn't join us. So I'm not worried about this group, but I always mention it. In January, what would happen is you'd get a next steps guideline that includes information about various requirements, guidelines, deadlines, things you have to accomplish in order to join us in July. One of the things that's on there, and we've always asked incoming folks to bring a computer, but now specifically a computer that has a webcam, because we do so many things virtually, and that even when we don't have COVID, that'll probably still continue to be the case. And then finally in April, a resident manual comes out. It gives you guidelines about the ortho program plus HR guidelines. Now, I said that one of my other roles is serving as the director of the OCS program, and in this case, focusing on the master's degree. So with ortho residents, they typically dually enroll, enrolling in ortho as a residency program, and then OCS as a graduate degree. So what we have is a curriculum that's been developed that works very well for ortho residents. And, from your perspective, you don't need to worry about this, but the OCS program as a graduate degree is administered through the graduate school, while all residencies, which are certificate programs called advanced, actually not graduate, they are administered through the School of Dentistry. And our goal is to just make sure things go smoothly. It doesn't, there's no extra cost for you to participate in the OCS program. In fact, there's a potential for you to get a graduate research assistantship, which means an additional $5,000 annual tuition waiver, so another plus for you. And that $5K is applied against 30 credit hours, which is what it takes to get an OCS master's degree, where you can see for ortho that's actually 45 credit hours. But the goal is graduating with 2 pieces of paper, one that certificate in ortho and the other a master's degree in OCS. How do you apply? Well, you would be eligible to apply after you're accepted, matched with this with the ortho residency. The GRE is required, but you've already taken that because it's required also for the ortho application. So check on that. And well, typically you would apply in February. So if you would match with UMKC, we'd contact you in January. Asking you and giving you guidelines about that application process. Some components of your residency would be able to be used, but there are some that are specific to the graduate degree and the School of Graduate Studies. But, again, nothing for you to worry about. We'd provide the guidance that you need for that. And the goal is when you get here, you start both programs. It's very structured with the idea when you come to the end, you're done with both. I have a question there, previous research experience, and if you were here, I'd ask you, but you're not, and so some of you will have it, some of you won't. It's not an absolute requirement. We provide mentorship to make sure that you are successful, whatever your experience level. And that's my contact information. Certainly there's other places to find it. But this has been hopefully a good interview, start of the day. You've got a long day ahead. I'll say this, you're going to get a lot of questions today, but take time for you to ask questions too. You want to find out if we're a good fit, we're a good family for you, because that is what you want. I think we are, but again, that you need to feel confident in your choice. And with that, I'll say sayonara for now and have a great interview day.